to you by the American Hospital in Dubai. We strive to give you a comprehensive look at a number of wellness and health-related issues every week, and welcome your questions in the live chat on Facebook, YouTube, and Instagram, so don't be shy. Every question matters. Whether you are a teenager or an adult, you probably have some concerns about your skin or hair. Whether it's acne, pigmentation, aging, or hair loss, we've got you covered tonight with Dr. Micaela Churruca, who's a specialist dermatologist at the American Hospital in Dubai. Dr. Churruca, thank you so much for being with us and welcome to the show.
Thank you very much.
Before we begin, as usual, let's tell the viewers a little bit more about you. So you have a medical degree from the University of Basque Country in Spain, and you have worked as a dermatologist in Madrid for several years before moving to Dubai. You're also a member of the American Academy of Dermatology, as well as the Spanish and European Academies of Dermatology and Venereology. You are also well versed in medical and surgical dermatology, as well as cosmetic and aesthetic dermatology.
Yeah, that's true.
I look forward to tonight's questions and answers because we have a lot of questions about skin and hair. But let's start with the first 10 quick questions. Are you ready?
Yes, I'm ready.
Okay. So why did you choose to specialize in dermatology?
It's a very comprehensive specialty. It has medical, surgical, and aesthetics.
And what is your biggest career achievement?
It's my everyday achievement, patient positive feedback.
What are the essentials of a skincare routine in 3 words max?
Cleansing, hydrating, and protection against the sun.
Myth or fact? Your skin adapts to products you use and eventually they stopped working. Is this true? Myth or fact?
It's a myth.
Your quick tips to combat signs of aging?
I would say antioxidants, retinoids, and sun protection.
Do the vitamins that we see for skin, hair, and nails actually work? Do they actually help?
It could, yeah.
And at what age do you think is it advisable to start Botox and fillers?
So your skin laxity and wrinkles are going to define when to start Botox and wrinkles, not your age.
And what is the one product you think is essential for beautiful skin?
Again, sun protection.
Okay. What are the most common causes of hair loss you see?
Male pattern alopecia and stress.
And can you eat your way to beautiful skin and hair?
Yes, you can.
Okay. So that was very informative, even though the answers are short and fast. When we think of dermatology, usually we think of the skin more than the hair. But obviously, the dermatology covers a wide range of diseases and maybe skin and hair problems. So what are the most common things you treat here at the American Hospital?
So as you say, dermatologists, we don't only see the skin, but we treat as well hair, nails. So we could treat medical conditions, for example, acne, eczema, psoriasis. We do as well surgeries when we want to, for example, remove a mole or some skin cancer, and we do then the reconstruction of the area. And we do as well aesthetics, many skin and hair treatments, also body treatments, to improve the quality of the skin, hair, and body as well.
Tonight we want to find out as much as we can about skin treatments and how to take care of our skin. So let's begin with what makes a good skincare routine.
So skincare routine is a must for everybody. Mainly for each of us, it doesn't matter if we are men, women, young, old, the main steps or the pillars are the same. I would say that all of us, we have to start by cleansing. The second step should be treating or maintaining. The third step should be hydrating, and the fourth step is going to be sun protecting, right? So all of them are the same for everybody, whatever is our age. By cleansing, I mean that we have to clean 2 times a day, morning and evening. Then we go to the second step, which is treating. This is the step that is going to be different in each of us. When I say treating, I mean using active ingredients for the skin to treat some conditions. So for example, it could be fighting aging. So most probably we will use antioxidants, retinoids, or for example, we could treat acne, so we will choose treatments for acne. very, very important is hydrating. Everybody has to hydrate, but the important thing is to try to always choose the correct hydration. We have different kind of textures, creams, gels, serums, so it's important to choose the correct one. And as I said before, the last step and most important is sun protection, which is a must. Every day when we are outdoors, and we have to repeat every 2 to 3 hours.
Now, sun protection, what about dark skin? Do you use sun protection?
Yes, they have to use sun protection. It's true that their skin is more protected to the sun just by normal anatomy, but there are conditions that could develop in also darker skins, like pigmentations, for example, melasma, like skin cancer as well. So it is important to protect ourselves against the sun.
The number of creams and scrubs and masks that we see in shops, pharmacies are many. So how can you pick the right product for your skin, and what is better? Is it like the pharmaceutical products versus the famous brands that we see?
I wouldn't say it's versus. I would say they are complementary. Some of them, they could be very cheap and they could be very, very good products, and some of them they could be very expensive and the same, very good or very bad products. So at the end, the main issue is the molecules that are inside the products. I can imagine that as a consumer, to see all these products available in the market, and all of them claim to be the best, it could be very confusing, right? So first thing is to visit your dermatologist, to know a little bit more about your skin, to see what type of skin do you have, and from there to choose the correct products for your skin.
Now, a lot of people use vitamin C and retinol. Would these work for all skin types to combat aging, or are they specific to a certain skin type?
It could work in all skin types, but we have to understand that these molecules sometimes can irritate the skin. So we have to be careful in patients that they have a predisposition to have eczema, or they have dryness on the skin. So we should always assess the patient before prescribing this kind of products. But as a main concept, yes, they could work as anti-aging for every skin type.
Collagen supplements. I'd love your professional opinion on them, because again, there's a lot of controversy on whether they work or not. Marine collagen versus other types of collagen. What are the best types to use, or do they work?
This is a very controversial subject. As of now, there is not scientific evidence that collagen supplements may help directly the skin. And this is because collagen is a very big molecule. So when we take it, it's going to split in our guts before the absorption, because we cannot absorb so big molecule. Then when these small molecules are inside our bloodstream, they will join again to create again the collagen. And then this collagen is going to be used wherever is needed the most, which could be your joints or your skin as well. So directly there is not an improvement of the skin, but of course somehow we are helping the body to have the main ingredients to create collagen. So yes, it could help.
Are there certain collagen that are better than others? Like, is marine collagen really better or superior to other forms of collagen, do you think?
Again, it's the same question. At the end is how this collagen is made, what are the main components of this collagen. So there is no superior to others. It's just a matter of the molecules that are inside the collagen.
Doctor, I just want to point out that we do have an Instagram question,
Great.
But it's about hair loss, so I'm going to keep it until the section about hair loss. So stay tuned. We are going to come to your question in a bit. Staying with the skin, acne is a major problem we see in teenagers, and we even see with middle age sometimes. So what are the best treatments? Or let's start with the causes actually. What are they mostly hormonal, or are there any other causes of
So acne, as you said, it's a very common disease. We see a lot of cases of acne as dermatologists, and it mainly affects adolescents, but it can also affect adults and even children. Acne is an inflammation of the sebaceous gland, and it's multifactorial, which means that it has different causes at the same time. On one side we have the genetics, we have the hormones, we have inflammation, we have bacterial colonization, so we will have to address all of them at the same time. At the end, it's important to see the patient, to assess the patient, to do a global assessment to see what could be the cause, the main cause of its acne, and then to choose the medications. There is a lot of different medications, so each acne is going to use different medications.
But are usually a lot of the causes hormonal, especially when you see, let's say, acne, maybe not in teenagers, because obviously teenagers are passing through so many changes, but later on in your 30s or 40s, sometimes you do have some peripheral acne as well.
The truth is that, yes, acne is always hormonal, whatever is your age, but the main cause of this acne or the hormonal disbalance in this acne is going to be much higher in people that they are already in the middle age than, for example, in adolescents. So whenever we see, for example, a woman in middle age that it's having a lot of acne, we should always check the hormonal status of this woman, and to check also other symptoms of hormonal disbalance, like hair, like oiliness on the hair, like polycystic ovary, for example. So all these things are related.
Okay. One of the main medicines that is used to treat acne, and usually severe acne, I would say, is isotretinoin. I don't know if I'm pronouncing it correctly, more well known as Roaccutane. So how beneficial is this medicine in treating acne, and what are the side effects?
Oral isotretinoin, it's very used for moderate to severe acne. It's a molecule that what it's going to do is to shrink the sebaceous gland and to reduce the production of sebum, as well as creating like a peeling effect on the skin. So there is a lot of side effects from this medication, but most of them are mild. But also there are some side effects that are not so mild, so as doctors and as patients we have to be aware of these side effects, and it's very important that always this medication is under control by a dermatologist. The patient should come every month, we should do some blood tests, we have to do an assessment, so I would say that well controlled, this medication is safe. And I would say that the vast majority of my patients say that the benefit outweighs the risks.
Okay, and we actually have a picture here for acne before and after, if we can have a quick look at it. But what about the excess? How can you mitigate or decrease the side effects of such medicines?
So the truth is that dryness is a common side effect in almost all the patients. So a good moisturizer is always very important. To also avoid to use things that could irritate more the skin at the same time, like using for example, antioxidants or other topical retinoids at the same time, using acids. So yes, trying to decrease the things that could create dryness on the skin. And it's very important also to have good sun protection, as the skin is more sensitive at the time that we are using isotretinoin. Sun protecting is going to be a must.
Yes. Moving on to some of the skin treatments, some of them are skin peels, and there are various types of skin peels, the mild one, the medium, and the deep skin peel. So can you explain to us the differences, and when is it good to go for a chemical peel?
Chemical peel, it's a procedure in which we are going to apply chemical ingredients on our skin, some products that are going to create a peeling effect, removing the top layers of the skin, so having a new skin coming out, right? In terms of categorization, there is light or superficial peels, there is medium peels and deep peels, and the difference between them is the depth that the product that we are applying on the skin is going to reach. Deep peels are not mainly done here at the American Hospital. We don't do them because there is a lot of side effects from them, and we do light and medium peels. As I was saying, the depth is going to be different, and as well as the peeling effect and the downtime from them. So at the end, we should choose the peeling that the patient is going to be able to manage in terms of how long he's expecting to have results and how much downtime he's able to have.
So with the light peel, how much is the downtime, and with the medium one?
Usually with a light peel, downtime is not so long. Of course, again, we have to moisturize the skin, to sun protect the skin. Every time that we do an aesthetic procedure is the same steps. And we do one session every 2 to 3 weeks, 4 times. And usually he can come back to his normal life after a few days. When we do a medium peel, the peeling effect is going to be much visible. So most probably he will be peeling for at least maybe 1 week. So he should know this if he's working in front of public, for example.
Yes. Some of the other treatments as well are lasers, and lasers are also used for various conditions. Some of them are pigmentation, maybe open pores. Can you explain what the different types of laser treatments are and which one is good for what type of condition?
So lasers are, I mean, all over the market. We have thousands of different lasers. Here at American Hospital, we use mainly 3 types of lasers. Fractional laser, which is going to do a skin resurfacing. So it's going to also remove the top layers of the skin. And is it used too much for wrinkles and for skin rejuvenation? We do as well vascular lasers for red lesions on the skin. For example, rosacea, for example, some blemishes or inflammatory acne, spider veins. And we do as well laser for pigmentations like melasma, solar spots, freckles, and then I cannot forget about laser for hair removal, which is, I mean, very popular.
Now, the lasers for pigmentation, for example, let's just explain how many sessions would you need for each type that you mentioned. So the ones for the rejuvenation and the anti-aging, how many sessions would you need to see results, and the same for pigmentation?
So again, it's a matter of the downtime that the patient is able to manage. When we do a fractional laser, we can go a little bit higher with the parameters, so we achieve more peeling effect again or more resurfacing effect. But the downtime is going to be higher. So just for example, with 1 session, you can achieve the result that you are expecting, but you have to know that downtime is going to be more. If you want to do something that doesn't have so much downtime, you will have to do more sessions. With pigmentation, I would say that usually we do between 2 to 4 sessions to remove some pigmentations. Others need a little bit more. Because also the pigmentation could be very different from one patient to another. So that's why the assessment is always very important, also to meet the expectations that the patients have.
Mesotherapy and PRP are 2 very common treatments, very well marketed across the board. But what are the differences between these 2 therapies? What is mesotherapy and PRP, and how do they differ?
So PRP and mesotherapy at the end is the same technique. What we are going to do is we are going to inject something on the skin. The way that we can inject is directly with just injections, or we can use what we call microneedling. Microneedling is a procedure in which we have very small needles that are going to be glide through the skin, creating thousands of injections at the same time and delivering a product inside the skin. Then what is the difference between PRP and Meso, or what we know as PRP and Meso? The difference is the product that we are injecting. When we do PRP, we will take the golden plasma from the blood of the patient and we will inject it in the skin. And when we do mesotherapy, we will choose a pre-selected cocktail of vitamins or medications to treat different conditions.
Now, how many sessions would you need? So with PRP, you're re-injecting the person's plasma into their face, let's say. But how many sessions would you need to see the difference and maybe restore the collagen production?
As most of the aesthetic treatments, we need several sessions to achieve the final result. But with PRP, we can say that mainly from the first session, we can see a difference in the glow, in the freshness. Sometimes, for example, in the pigmentation, if we are targeting pigmentation, I would say that at least a course of 4 should be needed. But again, it depends on the patient and on the indication.
So PRP is also good for pigmentation?
Yes, we can use it as well for pigmentation. Yes, at the end, we are renewing our skin.
Okay.
So, yeah.
Okay. Mesotherapy can also be used for hair loss. It's not only for the skin and rejuvenating the skin. So can you explain to us how it works for the hair? And I think we have a picture here also that we can show.
The way that we do it, it's mainly the same, or we inject directly the product, or we do the microneedling. Yes, this is direct injections on the skin, on the hair in this case. The way that is going to work, what it's going to do is, first of all, by microneedling, we are going to increase the blood circulation to the scalp. So this means more food, more oxygen for our follicles, for our hair roots. At the same time, we are increasing the collagen production, which is collagen, as I said before, is the main molecule in giving strength to the skin and to the hair. And again, it's a renewal or growth of new cells on the area, so we can create new hairs by doing these techniques.
How many sessions would you need?
In these cases, usually we need more, because hair takes quite a long time to see a result. First of all, we have to stabilize the hair loss, stop the hair loss. And second, we will have to see a new hair coming, a new density. So usually it takes around 6 months to 1 year to see the big difference in hair loss. Yes.
You need a lot of perseverance.
Yes, yes.
We actually have the question that I was talking about. It's an Instagram question. Someone is asking, they are 45 years old. They have lots of hair loss. What could be done and what kind of testing should be done to determine the cause?
Okay. So this is very important. What this Instagram has said is that, first of all, whenever we have a hair loss, we have to assess the patient. There is a lot of different causes of hair loss, and not all of them can be treated with Meso or PRP. So we will have to do maybe some blood tests to see if there is some deficiencies, for sure to check the scalp to see what is the cause of the hair loss. Finally, of course, if we think that Meso and PRP is going to work for them, we will go ahead with this treatment. But if not, there is also other treatments that we can do. We have topical treatments, some medications that we can apply on the scalp. We have as well oral medications. And then, of course, cosmetics like anti-hair loss shampoos, ampoules that we can apply on the scalp. So there is a lot of things to do for hair loss.
You mentioned the blood test. When you're doing a blood test for hair fall, what do you look for? What do you test?
So usually we test for some vitamins. Vitamins are very important, especially vitamin B1, which is a very common supplement for hair treatments. And other molecules on the blood that are going to be very important for the hair, like selenium, like thyroid, for example, is also important. So there is a lot of things that could cause hair loss, and we have to check all of them if needed.
One other question on Instagram, also concerned about hair fall, but wondering whether the water here in Dubai or the UAE can cause hair fall, or is it hormonal?
I mean, it's not one or not the other. Of course, here in UAE, the water is a little bit more hard. It has more minerals on it. And this could affect somehow the scalp, but I don't think it's the only cause that is going to cause hair loss on our patients. So again, we will have to check if anything else is happening. We don't want to miss anything important on the patient.
But in most cases that you treat, what are the common causes? Is it usually hormones, hormonal imbalance?
No. For men, the most common thing, yes, it's hormones. It's what we call androgenetic alopecia or male pattern alopecia. So usually it's not a hormonal disbalance. It's the hormones that are doing some things on the scalp to make the hair fall, right? But also many patients with this causes effluvium, which is a stress usually on the hair. So as I said, there are many causes, but the most important ones are male pattern alopecia and stress.
If someone like watching us and is suffering from a hair fall, would it be safe at least to start with taking some vitamins, let's say, to combat hair fall?
I would say no. I would say that first it's better to come to see if there is any more important issue going on. Because if we don't address the main cause of the hair loss, anything that we are doing is not going to work. So it's just a matter of coming, getting checked by your dermatologist, maybe going ahead with some blood tests, and then addressing the important cause of the hair loss.
What are the most effective treatments for hair loss? We mentioned the mesotherapy, you mentioned some ampoules and the hair shampoos and vitamins, but from your experience, what are the most effective?
depending on the cause again, but for example, for male pattern alopecia, as I said, it's a hormonal issue. So at this moment, we are using some hormonal medications, oral hormonal medications that work very well on men. We can use them as well on women, but we have to be a little bit more careful, and we have to take some measures before going ahead with these treatments. In terms of other causes of hair loss, for example, the stress one or effluvium, I will say that taking some vitamins, using some topical minoxidil, which is a medication that is going to increase the blood circulation to the scalp. So these, I would say, that are the most common treatments for hair loss: hormonal treatment, vitamins, and topical minoxidil.
You mentioned that you would need to watch out with women for that treatment. So why?
Because at the end it's a hormone what we are giving to them. So usually we have to complement the treatment with other hormones, like for example oral contraceptives. So yes, it needs to be followed up by a dermatologist, but it could work. It could work for them as well.
One other important thing that a lot of people are concerned about is the eye area. Because you can either have dark circles, you wrinkle very easily in this area. So how can you best take care of the eye area?
So I would say that moisturizer, it's always a must. Most of the times, or a lot of the times, when I see dark circles, for example, there is a lack of hydration on the area. So we have to use a specific products for the area of the under eye. As well, at the end, we have different issues on the under eye. We can have pigmentation, we can have dehydration, we can have loss of volume, for example. We can have wrinkles as well. So depending on the condition of the patient, we will choose some treatments or others. But I would say that for everybody, hydration is very important.
Are there any specific things that can combat the dark circles?
Dark circles is a very tricky area to treat. But the same as you are using antioxidants on your face, on the skin on your face, it's good to use antioxidants on the skin on your under eyes, maybe at lower concentration molecules or products specifically done for this area. But yes, I would say that antioxidants.
Fillers and Botox. Before we end, I'd like to ask you one question about those. Obviously, they would need a complete episode to discuss them in detail. But now more and more men and women are using Botox and fillers. So you mentioned at the beginning that it's not about age when you start them. It's about the quality of your skin maybe, which determines when you start. But if you start at a young age, would you risk like aging more later on, or would you have side effects like if you fill your cheeks, let's say, you would need to fill more with age? And
I think no. The thing is that now we do much more fillers and Botox in younger people because we use very small dose, and we are doing it also like a preventing treatment, preventing from aging, if I can say. So as soon as we start to see the first little wrinkles, to use a very low dose of Botox, it's going to be enough to treat the area, and the wrinkle is not going to form anymore during the result, I mean during the effect of the Botox. So having Botox at a young age doesn't mean that you're going to have more wrinkles in the future. The same for fillers. If you don't allow the skin to have laxity, if you don't allow a loss of volume, then you will not have this problem in the future. So using at a young age Botox and fillers is a good idea to prevent from the aging and the loss of volume on the skin. So
it doesn't necessarily mean that you would need more filler as you age if you start earlier?
No, no. I would think that the opposite. Opposite.
All right. We also have one more question, which is about a mole, but I'm going to ask you.
Perfect.
So when a mole has been biopsied and there needs to be further removal, is there a maximum number of moles that can be removed in an office visit?
No, it's not there. No, it's not a maximum. I don't know how many he wants to take out, but of course, before going ahead to remove all the moles, we have to check them if we can with a thermoscope. So we will see really microscopically what is happened to this mold, and then after the correct assessment, we will decide if any of them have to be removed. but we don't want to do scars just by doing scars. So we will try just to remove the ones that really need to be removed.
One more question this time about eczema.
Yes.
So is eczema caused only by allergies, or could it be due to worries and psychological factors, or could it be hereditary?
So eczema or dermatitis just means inflammation on the skin. And this inflammation can be caused by a lot of different things, a lot of different triggers. Allergy is one of them. Irritation is another one. Genetic or genetically predisposed eczema is the one that we call atopic eczema or atopic dermatitis. That's another one. So there is many causes of eczema. And again, to come, to get them checked, to see what is the issue. Because yes, we can apply some creams, we can apply some treatments that are going to help treating the actual eczema, but at the end we need to know the main cause and how to fight it and how to prevent to have more episodes of eczema in the future.
Because they flare up usually at different times.
Depending on the cause. If it's something punctual, for example an irritation, it doesn't have to come back. But if it's genetically predisposed, for sure it's going to come back if we don't take the good measures like hydrating, using treatments when needed. So yeah, a good assessment is always important.
Dr. Churruca, thank you so much.
Thank you very
it
much.
was very insightful. I certainly learned a lot about skin treatments, and I hope our viewers did too. Obviously, glowing skin and healthy hair increase self-confidence and self-esteem. But it's also important to mention that inner beauty is just as important. And so I'd like to leave you with that in mind. I'd like to leave you with one of my favorite quotes about beauty from the famous French designer Coco Chanel. Beauty begins when you decide to be yourself. So don't forget to like and share this episode on Facebook and to subscribe to the American Hospital's YouTube channel. I'd like to wish you a happy new year. I hope all your dreams come true in 2021, and have a good night.